can the government require someone to get the COVID-19 vaccination?
Which government? State or federal? The answer
Important
is
question.
Depends. So there's a number of tiers of that. First of all, the federal government can probably not require all citizens in the United States to get the vaccine because it's not within one of its powers. It can, on the other hand, for example, condition getting a passport on getting a COVID-19 vaccine. If the government sets a condition of getting passport, there are limits to that because the right to travel is a fundamental right, but it can set conditions for getting a passport. State, or it can set conditions if it affects interstate commerce. For example, it can say, if you have a trucking company that goes across state, your drivers have to get the COVID-19 vaccines to be licensed. States have broader power. States have the plenary power to regulate in the public health. That means,
is this the same as the police power, or is this a different power?
So plenary power means that means that everything that isn't given expressly to the federal government is left to the state. One of those is a power to regulate in the public health. In 1905, the Supreme Court upheld a smallpox vaccine mandate on the grounds that individual rights can be set aside when it's in the public health.
This was the Jacobson decision?
Yes, that's Jacobson versus Massachusetts in 1905.
And there, even in 1905, you had an example of a state, or in that case, I think it might have been a city, requiring individuals to get the vaccination.
Exactly right. The state of Massachusetts allowed cities to require vaccination from adults or fine them criminally $5, which is higher today, if they didn't get the vaccine. Cambridge, who had a smallpox outbreak, for a number of reasons, it's unclear that Jacobson would allow a universal state adult mandate for a vaccine. First, even Jacobson was about allowing cities to mandate it during an outbreak. Second, our respect for bodily autonomy has increased since Jacobson. Third, a $5 mandate during an outbreak isn't throwing people in jail without one. And fourth, smallpox isn't COVID. COVID is dangerous. It's a very serious disease. But smallpox had a 30% death rate with the more aggressive strain of it. So smallpox was an extremely dangerous disease. I think the state would have a better chance of legally requiring vaccines the narrower it goes. So, for example, there's nothing stopping the state from saying all healthcare professionals that work with COVID patients have to get a COVID-19 vaccine unless they have a medical reason not to. There's nothing stopping the state from saying meat plant workers, essential workers in places that are high risk, have to get a COVID-19 vaccines. But the universal adult mandate, unless there's an area that has high risk, might be harder to justify in court.
So there's some kind of a balancing test here. If the disease was much more deadly or much even more contagious than it is, there could be a requirement for every American or every resident to get a test, to get a vaccination. But
exactly
what you would expect for this particular vaccine is niche industry, or is specific industries,
or high risk areas, or hotspots.
High risk areas.
Children are trickier. So traditionally, there's a lot more power to mandate vaccines for children because children don't have the same level of autonomy as adults. So you're not just protecting the public health, you're protecting the child. The problem here is that COVID-19 does cause a special syndrome that's dangerous to children, but it's still a lower risk than many other diseases we vaccinate children against. So there's a question, can we mandate it for children? It will partly depend on the risk profile of the vaccine. A super safe vaccine against a disease that does sometimes kill children and that does sometimes cause them serious harm is a lot more justifiable than a vaccine with some serious risk.
Interesting. So the fact that COVID itself doesn't seem to have the same danger to children as some of the other diseases that are in-state mandates may mean that a COVID vaccination mandate might not happen.
Yes. Also remember that right now we're testing COVID in adults. We haven't started trials in children at all. So children are way down the line, for good or bad, for a mandates as well. I will add one more thing. States are not the only ones that can mandate. Private employers can mandate, stores can mandate, And they have quite a bit of leeway.
Yeah, let's talk about that. So, if I run a barbershop, Joel's barbershop, and I want to make sure that all my hair cutters are vaccinated, can I require it?
Yes. So a private employer in the United States can generally set health and safety conditions. There's a few limits. One is if your barbers are unionized, you may have to follow the collective bargaining agreement, and some of them would require you to negotiate with the union before you require it. The other is federal anti-discrimination law applied to employers that have more than 15 people. That's the American with Disability Act, which would require exempting someone with a disability with some exceptions. And the Civil Rights Act, most relevantly, may exempt people with sincere religious objections to vaccine, again, with exceptions.
And those tests are actually different on the two laws. So the ADA requirements are a little bit more stringent.
That's exactly right. The ADA, so to be exempt from the ADA, you have to either show that the person is a direct threat to others, which you may be able to show depending on the circumstances, or that it's a very significant burden on you, the employer, to accommodate their disability. For the Civil Rights Act, you just have to show that the burden is more than de minimis, more than minimal cost.
So as long as it's something legitimate, serious, which in the case of COVID-19 would arguably be easy to show.
Well, yes and no, because so what you need to do if you have to give the exemption is to give what's called a reasonable accommodation. So if you can achieve the same health benefits with a mask for the employee, then that's a minimal burden on you. You can still achieve the safety. If you have a reasonable alternative to keep the employee working for you, but reduce the risk to your customers, then you have to provide that.
Interesting. So if social distancing and mask wearing offered the same reduction,
or if, for example, you have some workers that are customer facing and some workers that work isolated in little cubes without contact with anyone, you can say unvaccinated workers can stay with working for me. They have to work in that cube.
Another concept that's been raised is requiring some type of proof of vaccination, perhaps to fly internationally. Is that something that you see on the horizon or even legally possible?
First of all, some countries in Africa require proof of vaccination for yellow fever to come in. It's legally possible. There's limits because the right to travel is a fundamental right, but this is probably justified enough to do it. There's no absolute right to get on a plane. The problem will be a practical enforcement problem. How do you enforce that? People don't always have the vaccination record. They won't always have them available. This might be actually easier for flight because people are already used that they need to bring certain documents in order to be able to fly and meet certain requirements. If you try to do it for, let's say, Amtrak trains, buses, traveling across toll roads, you may run into very real enforcement problems.